Hi everybody, Big Papa Scott here. We're going to talk about stroke today. Stroke is a cardiovascular problem, so it involves both the heart and the brain, the vascular system, and that they're all kind of connected. We're going to talk about it today. I put the definition of a stroke according to Mayo Clinic, which I use for a good portion of my information because they're the best. Stroke occurs when the blood supply to part of your brain is interrupted or severely reduced, depriving brain tissue of oxygen and nutrients. Within minutes, brain cells begin to die. A stroke is a medical emergency. Prompt treatment is crucial. Early action can minimize brain damage and potential complications. The good news is that stroke can be treated and prevented, and many fewer Americans die of stroke now than even 15 years ago. Now I put the symptoms of a stroke right here on the screen. Watch for these signs and symptoms if you think you or someone else may be having a stroke. Note when your signs and symptoms begin, because of the length of time they have been present may guide your treatment decisions. Trouble with speaking and understanding. You may experience confusion. You may slur your words or have difficulty understanding speech. Paralysis, which means numbness or numbness of the face, arm, or leg. Paralysis means things don't work. You may develop sudden numbness, weakness, or paralysis in your face, arm, or leg, especially on one side of your body. To raise both of your arms over your head at the same time. Try to raise both of your arms over your head at the same time. If one arm begins to fall, you may be having a stroke. Similarly, one side of your mouth may droop when you try to smile. Trouble with seeing in one or both eyes. You may suddenly have blurred or blackened vision in one or both eyes, or you may see double. Headache. A sudden severe headache may be accompanied by vomiting, dizziness, or altered consciousness. May indicate you're having a stroke. Trouble walking. You may stumble or experience sudden dizziness, loss of balance, or loss of coordination. So these are the symptoms. It's very important to recognize these symptoms because in the long run, you have about 4 minutes to 10 minutes to get an ambulance there, hopefully. Start treatment. They will start treatment in the ambulance with a drug probably called heparin, which will help dissolve any clot that is causing the stroke from happening. They can do that in the ambulance on the way to the hospital, and hopefully that'll start to work and it'll thin the blood and hopefully dissolve some of the clotting that's causing the problem. As that happens, when they get you to the hospital, then they have to address where the blockage is and what else they have to do. They have stronger clot-dissolving medications that can do that. Now here we have a picture of some of the vessels that are leading to the brain, the arteries. Remember, the arteries take blood to the body, including the brain, and the veins take the blood back to the heart. Now these are all arteries that are shown here, and you can see how they go up to the brain through the neck. And one of the things that you have to realize is that in each one of these circles here, you can see the first one on the bottom is a normal carotid artery, and then you can see a diseased carotid artery right here, and that disease you can see is filled with, remember I talked about plaque in the heart. This is the same thing. This is plaque in the carotid artery, and then the carotid artery is right where this circle is, and that's where it kind of splits off and goes up into the brain, and one side of the brain and up into the middle part of the brain. So most of the time the blockage will occur right there And if the blockage is significant enough, it will cause a clot to form, and the clot will stop blood flow to that entire half of the brain. This is a severe stroke. This is one that will completely paralyze you on one side if you don't get to the hospital quickly. And then in some cases you can have just a small clot like here, and that small clot will make it through this vessel all the way up, but when it gets to here, it stops and blocks off supply of blood to where you can see this section here that's kind of blackened. And what's going to happen is that section that's blackened there will die. And anything in the brain in that section that is controlled by that section, so maybe it's, you know, part of your vision, part of your speech. I'm not that familiar with how the brain works. I don't think very few people are, but you know, it's one of those things that once that part dies, there's no going back. You have had a stroke and you may be paralyzed in the arm or in the leg, and you're kind of stuck with it for the rest of your life. That's why, again, I'm going to say it as many times as I have to say it. You need to get to the hospital as quickly as possible, because they can dissolve this clot with some medication and you'll be fine. And then they can go in here into the carotid artery, which, like again I say, is right here, and they can put a stent in here which opens up the artery. So it kind of crushes this plaque to the side of the artery and opens up the artery itself. So that's definitely an advantage to getting to the hospital quickly, is that once they dissolve the clot, you'll have restored blood flow. It may not be the greatest blood flow. You may have noticed some symptoms beforehand. Maybe some numbness and tingling, you know, that comes and goes. It's one of the signs that there's a blockage going on and you need to get it addressed. There's a relatively simple test called a carotid artery scan, ultrasound scan, which will show the carotid artery. And if you have a nice normal carotid artery, it'll look like this. And you can see there's a nice clear wall here and a clear wall here and no plaque. So none of this yellow junk here, which is plaque, and flow is normal. But in this ultrasound, they will see this blockage here, and they will see what they call turbulent flow going up into the brain. So they will see the blood flow on the ultrasound. It's shown in what we call color flow Doppler, which is very hard to explain to people, but it shows direction of flow and turbulent flow. And then they can also sample the amount of, or the velocity of the blood flow and determine whether it's stenotic or not. So if there's a narrowing there, they'll be able to pick it up right away, and then you can go either to the cath lab and have a stent placed, or if it's severe enough, I don't know if they still do the surgery, but they used to do a surgery called an endarterectomy, which is where they went in and removed the plaque. So they would open the artery quickly. They'd have to clamp the artery down here, and they go in and quickly scrape out all this plaque that's up here and up here, you know, all this plaque. Once they scrape it out, they sew the artery back up again real quickly, and then they take the clamp off, because the longer the clamp's on, obviously you have no blood flow going to the brain. So they don't want to do, they want to take, you know, only 5 or 6 minutes at the most to do this, so it's quick surgery. But anyhow, that's one of the surgeries they do. Not everyone needs that surgery. Most of the time they can do a stent placement now, so it's a good thing. Okay, so this is from the same Mayo Clinic site. I wanted to, I forgot to put down the site name, but it's in the beginning of the slides or the beginning of the presentation. So you want to call 911 or your local emergency number right away. Don't wait to see if symptoms go away. Every minute counts. The longer a stroke goes untreated, the greater the potential for brain damage and disability. If you're with someone you suspect is having a stroke, watch the person carefully while waiting for emergency assistance. They can have a seizure, there's a lot of things that can happen. You need to be there in case they pass out or in case they fall over. Make sure they're sitting down or laying down. Do not let them walk because the chances of them falling are great. And you don't want to have them having a stroke and also breaking a hip. You just don't want it to happen. So I put that up there to make sure that people know that these are the things you need to do immediately when you see those symptoms. The inability to lift both arms up to the same height, and keep one arm starts to sag and go down. That's a sign of a stroke. Or if you see that one side of their face is drooping and they can't really smile without the one side staying in the same place, that's also a sign. Confusion, severe headache with numbness and tingling on one side or in the arm, or it can be anywhere. So anyhow, those are the symptoms. Pay attention. This could happen to you or a loved one, and time is of the essence. If you do not do something right away, you will be in a wheelchair probably for the rest of your life. So I'm not playing here, folks. Get the emergency assistance you need, and once you do that, hopefully you'll recover fully and things will be great. So that's all about a stroke, and we'll see you next time. Bye.